Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
Good morning, good morning.
Good morning.
You got us with our pants off.
Yeah.
I'm sorry.
Yeah. Okay, let's put the pants back on.
Oh, my goodness. Well,
Sneak attack.
Sneak attack. You know, before we get into what we're going to talk about, I'll tell you how funny. I met a clinical sociologist who deals with elder patients, and she's, I think, maybe going to start advertising, but she was saying, well, she deals in pornography and she deals in all this, and I said, so I said, what's wrong? She said, well, a lot of people have a problem with pornography because blah, blah. I said, but wait a minute. Pornography is not bad. If there's a couple who like pornography to watch, I said, my husband and I like this. I mean, with that. So she said, oh, I understand. I said, so don't make it. There's one thing that's pornography, which is, raw and very bad. But sometimes older people need stimulation like that, right?
Right. It's up to the couple what they need.
That's right. And so whatever they do in their bedroom is not bad.
In their house.
Right?
Right.
Okay.
The only problem with, with pornography or any other thing that are private things.
Yes.
Is when you bring it out to kids that are growing up and try to influence other people to follow their belief.
I'm just talking about...
thing that
you just
is
put
your
a video
belief
on
and
of course.
Makes you happy, tickle you here and there,
Well, let me tell you, it's funny. Hefner just died. But we used to get Playboy magazine.
Mm-hmm.
I mean, I thought a lot of the articles, I learned a lot from it. But I also, it was a sexy, it was sensual. It's okay, if you, between your partner, whatever you do. And I'm sure Chandler learned a lot from my son.
It's, when it comes to sexuality, it's society still opening up, So we are opening up as a society when it comes to sexuality, and other society look at us down because we are so open.
Right. But I have a cousin who went to China, and she was telling me that even in the airport, was it China? Excuse me. It was India.
Mm-hmm. India.
And they have, of course, the Kama Sutra everywhere. And that's just common to see, pictures and to have, I guess, monuments that are there that, show people, in sexual situations.
Sexual
poses, right. Okay, now
Dr.
let's get
Pose.
serious. I thought this will get... Wait, no, more than that. But interesting, I know, I just had to... I just came back from San Francisco, so what can you expect,
well,
right?
I tell you, it have changed a bit in Europe. But I remember back in the day when I used to travel to Europe, you would be watching TV and you bump into a channel and say, wow, they should be like restricted. And they were not restricted. It was, open.
It's like that now here. I'd be watching HBO and all of a sudden a channel comes on like that. So whatever it is. But I want to talk about something now more serious.
Mm-hmm.
I want you to describe, in your own words as a physician, about concierge medicine. Because I've had people say to me, well, I now go to a concierge doctor. And they think that that's so good. And maybe it is with some doctors, but after I heard what they said, I said to myself, well, Dr. Mencia is a concierge doctor without charging.
Without charging. And it is so true, and people from this kind of concierge company have approached me in the past in numerous occasions. And when they come to my office, they say like, well, you're really practicing concierge medicine. For you to change, out of your thousands of patients, you just need to take 1,000 and charge them X amount of money. And you're going to be making so much more money. You're going to have more time for yourself. You don't have to work so late. And I, whenever they have approached me in the past, I look at the ugly side of concierge medicine. So if you have 4,000 patients and you pick up, they say, you can pick up to 500 patient. That's enough for you to make a good living. And you charge 500, 600, 1,000 patient X amount of money. And you are making a good living. The ugly side is that you have taken over 3,000 patients and throw them on the street.
Absolutely.
You know? And they come to me and they say, oh, I used to go to this doctor and he went concierge, so I cannot afford that doctor plus my Medicare plus my supplement. And so I'm just looking for another doctor. And that's the ugly side, that when you go into concierge medicine officially and you charge people out of pocket, and, I think as a society, as a doctor, as an individual, I don't feel right charging you a person extra for my attention, to have my individual attention. I think it's a must. You must give your attention. That's what makes you a good clinician. When you are able to listen to your patient, what they have to say, and you are able to look at them, because when I'm looking at you and doing a physical examination, and I listen to you speak, I can look at your throat moving, as you are talking, and I can see if you have a lump in your thyroid or not. And I can see how your breathing is, if you are breathing normal, if you're using what we call accessory muscle from the neck and the abdomen. And we can learn so much just by observing the person as they give us their history of what brings them to the
But it
office.
takes time to do that.
It takes time, right? And a good clinician doesn't need a lot of time. You just have to be very well organized. And that's one of the things that I have developed on AGI company. We had developed a system where Ian as an office manager and Doreen as a dental department manager, you have all these managers that make sure that the system is very well organized. And a lot of people, they come to us and they say, my God, I never been to a doctor's office that I have wasted no time at the waiting room. They put me right in the room. And, it's interesting because I was talking to one of the ladies that worked for an insurance company. And he said, we refer a lot of patients to you, Dr. Mencia. I said, oh, yeah, I see it. Because we asked the patient, how did you get referred to us? And when patients come and see a new doctor, whether they ask us or not, sometimes we have to survey those patients and ask them, how was your visit? And one of the things that they always said, when they come to see you, your office is so organized that they are filling out the paperwork in the exam room because we move fast. We make sure that your time is precious, and when you are there, we do what you need to be done for you, and not to be wasting time. And everybody's on the same wavelength in the practice.
So I have to. So
that's concierge medicine. That's basically
that's right,
concierge
but you
medicine.
Don't pay but you have to pay for.
But you have to pay
doctor.
and I don't think you have to pay. But that's my opinion.
Yeah,
I don't think
but
people
you're
need
extraordinary.
to pay.
And I've told you that, and I have to. It's my time to share some wonderful things. So I needed my flu shot. You've been telling me. So I went yesterday to get my vitamin D and went there. And the two women in the front do not know me. And that was important. They had no idea who I was. It was good. And please sign in, which I hadn't signed in to you. I was talking. But there are two people there. They give you the attention. And who do you want to see? And, of course, I said I want to see Ina, but I do need a flu shot. Well, all of a sudden, and what? I'm sorry, it's not. I forgot his name.
Oscar.
Oscar, I love Oscar. So he says, "Okay, come on in." I was there for 2 minutes. He goes, "Come on in," and he takes my left side of my blouse. We put it up there, and I said, "Okay, you're going to give it to me?" He said, "I did." "What do you mean you did?" "I gave you the flu shot." I said, "I didn't even feel it." He said, "Look, there's an empty vial." I mean but he's always like that. Every shot he never feel it with him. He's just fabulous. No. Okay, the other thing is I'm in San Francisco and I forgot I have a little an asthma, I guess you call it an inhaler. Okay. And I don't use it often. With all the
smoke and the fire in San Francisco and asthma, right. That's not a good combo.
Right, but it was even before that. But I just always travel with it, and you've been very kind about, and I have it, and I stay a year, and it's not even used up. But it was mental. I had left it at home, and I got a little worried. Even forget the smoke. I didn't know that happened yet. And I'm thinking, and my mind is working, I better get it. So here it is on a weeknight, Saturday night, I don't know, and I I text Ina and Dr. Mencia, and I said, I hate to bother you, but would you please, here's the Walgreens here in San Francisco, would you please do a prescription for my inhaler? Let me tell you, within 10 minutes from that, the Walgreens, you went and called them, Walgreens calls me and says, it's ready. Here I am in San Francisco, and here's my doctor and my princess here who's taking care of it for me. Now, I know we're friends, and I know that you'll do good, but you would do that for anybody, and I know that.
Yes.
That's called concierge medicine, actually.
Exactly.
And so, it depends who you're going to. A lot of doctors really don't want to be doctors anymore. That's what I'm getting a feeling about.
Yeah,
that's
with
the problem.
With the system, the way the system is going and all of that, a lot of people getting discouraged. A lot of hospitals taking advantage of that, hiring the doctor. They are going on a payroll. So once you finish the day, you block contact with those patients because you work for the hospital. You don't work for, those patients, they are not really yours. They are the hospital. They belong to the hospital, those patients. So you don't feel like I feel the attachment with my patient.
I know you do.
We belong to each other.
Yeah,
so,
I know.
And let me tell you, yesterday, I gave you a case. I hope Gerardo listening because I called Gerardo to help me from the billing department. Yesterday, a patient of mine, that she had been my patient for over 15 years. And then because of Obamacare and what have you, she couldn't come and see me anymore. And we lost contact for about maybe 3 or 4 years with each other. So when they mention her name automatically, I'm upstairs in the office in a meeting, and they mention her name. They say, oh, so-and-so is here. She want to talk to you. I say, oh, maybe she changed insurance and she want to come back. So let me go downstairs. So I said, it's a quick visit. I go downstairs. And I go down, and here she is. And I say, oh, we give each other a big hug. Oh, I miss you. She goes, oh, I miss you, Dr. Mencia. I love you. I love you too. Let's go in the room and talk. So we go in there, and she starts crying because her son-in-law was using drugs. The son-in-law and his daughter went to jail. The grandkid is being sent to foster care. And she's crying. She said, I'm the grandma. I'm 70 years old, and I need to get subsidized housing because otherwise they won't give it to me. So I say, you go and get the paper for subsidized housing. You bring it right back. I call Gerardo into the room. I say, I'm going to have Gerardo and Nadira work with you. They're going to fill out that paper. Whatever we need to sign, we're going to sign. If you need a letter of support, we're going to do it for you. And she said, well, why would they give it to me? I'm 70 years old. I say, who cares you're 70 years old? Society rather give the kid to a family member than to give it for adoption. So she got so excited. Really, Dr. Mencia? I said, yes. So she felt so peaceful. And this lady, she doesn't come to me anymore.
Of course.
But we have a relationship.
Of course.
And
this is who you are, and I think,
and that's the social aspect of medicine that we cannot neglect.
That's who you are. I want to give your phone number out now, so they are open on Saturdays, and if you want to just meet,
don't give it out. I need it at the office. No, just kidding.
Don't give it away.
Yeah, don't give it away. Don't give it away.
Sorry. Okay, everybody, get this. Put
Hawaiian
Talk
joke.
Radio. It's a Hawaiian joke. Yeah, I didn't get it. Too many coconuts. Okay.
With the vodka.
As a matter of fact, I bought a coconut and I can't open it. You'll have to help me.
Okay.
I can't. How do you open it? I got the milk out. But let me give you a number first, and then you can talk about coconuts.
Oscar can open it with a machete.
I'm gonna bring my coconuts to your. I mean, you do everything else. You get people. I might as well bring my coconut to you. Here's my coconuts. Oh my God. Okay. All right. Seriously, here's the phone number. It's 954-4. 489-1345. Okay, everybody. Now get your pencils out. Put it up on your refrigerator somewhere else. Here we go. 954-489-1345. Now that's the Fort Lauderdale Commercial Boulevard AGI. They also have, of course, another center in Boynton Beach. And did you get there yet? You were going to do this on Wednesdays.
I'm doing twice, yeah. I'm going twice a month now.
Right. So when is your next?
And Dr. Ecker is going there. When is the first?
The first and
the third.
Okay, so it's
Wednesday.
coming. All right, it'll be coming up.
Yes, he'll be there on the 25th.
Okay, so let me give you that phone number. That's 561-270-6494. And a lot of you listeners, you're responsible for that office opening because there were a lot of people that said, I want to come to Dr. Mencia, but it's too far to me to travel.
It's too far of a drive, yes.
Yeah, now I will go anywhere to find you, but some people can't. And so that's what's going to happen there. In fact, there is someone in Boynton Beach that Jolynn definitely says, I want a doctor. I can't wait. I'm so excited.
I got a visit by Medicare, and they were concerned because I have patients that we are billing for, but they live in Miami, so they were wondering if it was Medicare fraud. And I said, so we pull out the chart. I said, yeah, we have all these people that come from northern Miami-Dade, and they come here. They want
Absolutely.
To be, it's such a huge deficit of geriatric medicine.
Yes.
I'm telling them.
Right.
It's a huge deficit of geriatric medicine. I'm doing the best I can. I'm opening 6 days a week. And if I get my way and I get, resident to rotate, I might open 7 days a week.
I know you said that.
Because it's such a huge need of geriatrician in this country, in the whole country.
Yes.
And there's a lot of people that come to South Florida to retire, and they want to be taken care of without being over-medicated, and a lot of times when it comes to healthcare in the elderly, the least amount of medication you take, the better they do.
So what, now that you're talking about the geriatric, why don't you explain to people, we've probably done it before, but what makes the difference in coming to a geriatrician and going to a doctor who's been experienced, he's seen a lot of older patients? Explain what you just said.
Geriatrician and gerontologists basically are a field of in healthcare that specializes in the elderly. Now, when we define elderly, it's used because people used to retire at 65. It used to be 65 and over. There was a trend that started in the late 1990s. And the trend was people in their 50s say, I want to prevent from getting Alzheimer's disease. I want to know what I can do to prevent Parkinson because my mother had Parkinson. I don't want to have a stroke or a heart attack. So instead of going to a family practitioner, they said, let me go to a geriatrician that have this as a specialty. And people start coming in, and the demand was so big that doctor could grandfather. So you will go to the American Geriatric Society, you send a paper, I've been practicing in South Florida for 5 years, and I want a grandfather as a geriatrician. So the American Geriatric Society will grandfather and send you a certificate that you are a geriatrician, but you have no training. So it got to the point that they were making so many mistakes that the American Geriatric Society said, no, you have to be fellowship trained. So when the fellowship training started, it was a 2-year program, which is what I did. I did a 2-year program in geriatric medicine, which make you competent to run a hospital, geriatric department, nursing home, retirement community. Basically, you get all the knowledge in geriatric medicine and hospice medicine. And then the demand kept increasing, with one of the faster growing segment of our population is people in their 80s. So they decided, the American Geriatric Society decided, no, we're going to cut it down to 1 year training. So a lot of people now can choose if they want to do a 1 year fellowship or 2 years. So the way it goes is that you finish medical school, and then you go and do your residency as a internal medicine or family practitioner. Then you go into your subspecialty. If you want to go into cardiologist, pulmonologist, geriatric medicine, and so on. So I opted, I was going to go into GI, but my grandfather lived to 109. So I said, you know what? I'm going to go into geriatric. I want to learn more about geriatric medicine. And he was a healthy guy. He used to walk up in the mountains in Hawaii and take no medication. And I love that. That's the memory I have of my grandpa, as a kid. So I said, I want to go in the field of geriatric medicine. And as I went and learned more how people were being overdiagnosed, and, people think that an elderly person come to the office, and because, you have this old-timer here, old-timer, no Alzheimer. This old-timer is sitting in front of you that I have to give this person a prescription so they can leave me alone. And that is not true. They are there asking for help, and they are not there for a prescription. They are there sometimes for you to say, you are taking too many stuff, and for you to sometimes put your foot down and say, no, you need your diabetic medication. You cannot come off from that. So it's a lot of people that don't want to take a lot of medication, including myself.
Including me.
And then I started looking into holistic medicine, and I became a member of the American Anti-Aging Society. And I said, I want to learn more about holistic. And I say, wow, this is beautiful. If I can merge traditional medicine with holistic medicine, I think we can accomplish so much. And when the patient come to me and they say, well, do you want to start with something natural before we write a prescription for your sugar? They go, oh, yeah, sure. So we go and talk about cinnamon and talk about flaxseed, and we talk about all the homeopathic things.
That's right.
I take my flaxseed, I put cinnamon, if I'm drinking soy latte, I add a lot of cinnamon. If I decide that it's a birthday at the office and I'm going to have a little cake, I pull out my cinnamon and put down so that I can decrease the calorie count. And I just have my blood test, my sugar. My sugar was 64. And you want to be under 100. So it's like way under 100.
Fabulous,
yeah.
Right, because you practice what you...
I practice what I preach, so, it's up to the doctor to decide. You don't have to be a geriatrician, because when the patient come to me, and I have a few retired physicians that are my patient, and they tell me, I say, Dr. Mencia, I wish I would have learned about geriatric medicine when I was in medical school.
Dr. Mencia, I don't want to forget something. We have Ina here, and we have a big celebration that's happening of Stonewater. You have to talk about it, Ina. Yeah, let's invite everybody.
So let's ask
now you'll be there. Ask me questions. You'll be there, won't you? So people can.
Yes, absolutely.
And you'll
be there.
Yes,
and
I'll be there.
Yes, in all white.
Everybody will be there in white.
In white. But the guests, they can come anywhere they want to. But if they come dressed in white, it's even better.
Yes.
Okay, what are you doing, Ina?
Yeah.
As the manager of Stonewater.
As an executive manager of AGI.
So the event will be on October 26th. It's a Thursday, the last Thursday of October.
October 26th.
Yes.
And at what time would that be?
It will be 5 to 8.
5 to 8 o'clock. So we better get there early so we can have some of the odor and the little wine.
Yes.
Okay.
And because you want to show everybody.
And where is going to be?
It's going to be the location of Stonewater is 2767.
With a smile in her face.
East Oakland Park Boulevard, and it's in Fort Lauderdale.
2767 East Oakland Park. So that is Oakland Park in close to Bayview.
It's right before. It's right before Bayview.
A little bit west from Bayview. Okay.
Mm-hmm. And it's going to be on your left-hand side. You will need to make a U-turn, and here you are.
And also, I think the important thing is that what Stonewater is and why you're doing this.
Yeah.
Stonewater is a medical spa, And we have a variety of services there, from massages all the way to body treatments, facials,
Salt baths.
Salt bath, Vichy room for body treatments.
How's the
We
Vichy
have a
room?
full department, nail department, wonderful,
Oh, they're wonderful. Yeah.
ladies working there. And by the way, we are running now.
It's like, you know, the way they work at the nail department is like Indianapolis 500.
Mm-hmm.
You know, when the race
Right.
cars
It's really
pull to the
cool.
side and everybody just jump on you. So when
No, that's how they do it.
It's true. I went there to get my nails done, and one lady come in, the first lady that was no visit, started working on my feet. And I go, okay, so I lean back and drinking a little wine. And here come the other one, and boom, jump on my hand. And then here
No
comes,
hands to drink wine.
and then here comes the other one. Here comes the other person with the appetizer, with a little cheese and cracker. I say,
Yeah, well, I think what you've done is you've brought the same kind of concierge medicine to the concierge spa.
To the
Right.
You know, you're really
right.
going to give them a lot of care. I mean, they have, unfortunately, a lot of Orientals have started these, you know, big places you go in, and it's not the same. You really are, you have
It's
the
a different
training, yeah.
experience.
It's the difference between going through the drive-through at McDonald's and going through a 5-star restaurant. You choose.
No, it's
But,
beautiful that
yeah.
you've done this, and it's with your, you know,
And the
standpoint of
Stonewater
people.
Spa is open 7 days a week. That's another beauty
7
of
days,
that.
yes.
7 days a
7
week.
days a
Which
week.
is great for people like me, because sometimes I don't have time.
Right.
And I have to say, okay, I have to go on a Sunday, or, you know, if the Monday afternoon is slow, then I can call in
Right,
and,
right.
you know, they will.
That's
quit.
it.
Yeah.
And we're now out of time, but everybody, we're going to have a great time. Stonewater Med Spa. And if you want information, just call 954-8799. Again, 954-561-8799. It's going to be a wonderful evening. It's
It will
free.
be.
You get to meet Dr. Mencia and Ina and
Anita.
some beautiful people
And
there.
Anita.
Yeah.
I like
Yeah,
that.
yeah. And Rachel.
Right. I might even bring Charlie.
There you
A
go,
little
Charlie.
doggy,
Yeah.
Thank you very much, everybody.
Bye.
Thank you.
Next
Bye.
week. Bye. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.